So welcome to Inside Out 3. Star MC forgot to mention 3. Inside Out 3. Transforming negative emotion through Buddhist conditionality and CBT. CBT stands for Cognitive Behavioral Therapy. Thank you for inviting me. Through the process of preparing for this talk, I've learned a lot of things and I'm very eager to share with you my learning. So this is the content for this morning sharing. Basically, they're going to be 3 parts. The first part is on something very basic, because this talk is about emotion. So I'm going to share with you on what emotion is. From a Buddhist perspective, also from the Western psychology perspective. I'm a psychiatrist and also a Buddhist. So most of my sharing is from Buddhist perspective and also from the modern psychology perspective. Okay? Then the second part will be the very interesting part, is about the Buddhist principle of conditionality, which I'm going to talk about the Buddhist teaching of dependent origination and how we can apply it in managing our emotions. Of course, the most important part is the last part, which is how to transform negative emotions. I'm going to share with you the 8 approaches to how to manage our negative emotions. And so 3 parts. Okay, so we start with the most basic one. What is emotion? So before I share what I have in mind, can you say something about what emotion is? So I ask you, what is emotion? You can say in English, you can say in Bahasa Melayu, Hokkien, Teochew, Tamil, Cantonese, Mandarin, also can.
Something related to feeling.
Something related to feeling, yes, feeling. Chinese will be, Cantonese will be 𝐂𝐬𝐨𝐬𝐿, maybe. It doesn't have to be exactly accurate, just show me some words related to emotion. Feelings, expression, emotional expression, yes, what else?情緒, 情緒, 感受, 情緒. Tamil, I don't know, can speak Tamil? What is the Tamil word for emotion? Not sure. Hokkien, any Hokkien speaking? I know one word in Hokkien is 𝐂𝐸𝐸𝐷𝐸𝐸𝐷𝐸𝐸 𝐂𝐸𝐸𝐸 is the actual emotion, not the word emotion. 𝐂𝐸𝐸𝐸𝐸 is one of the emotion. Okay, let's see what I've got. The slide is not moving. What emotion should I be having now? Okay. Emotion basically means strong feeling. You look at the dictionary's definition. Emotion is a strong feeling such as love or anger or strong feelings in general. So any form of strong feeling is emotion. The root word comes from French and Latin, which means to move or to stir up. It's different from the concept of Vedana in Buddhism. Those of you who've been learning Buddhism for some time, you probably heard of the word Vedana. Vedana is a Pali word. The usual translation is feeling. So feeling is not exactly the same as emotion. In psychology and in general English usage, emotion refers to strong feeling. Whereas Vedana in Buddhism, the feeling refers to pleasant feeling, unpleasant feeling, and neutral feeling. Got it? So what is your feeling now? I specify, what is your Vedana now? Now your feeling, is it pleasant? Pleasant? Neutral? Any unpleasant feeling? So Vedana is very... it's not a strong, it's a feeling, but it's not a very strong feeling. It's just pleasant, unpleasant, and neutral. When you use the word emotion, you have stronger feeling, like anger, like 𝐂𝐸𝐸𝐸𝐸𝐸, like depressed, like jealousy, guilt, shame, anxious, envious, etc., etc. So these are stronger feeling. Okay, so emotion means strong feeling. So far so good. Happy, of course. Happy is also the strong feeling. So that's emotion. Okay. Is there a Pali word for emotion? Yeah. From my studies, I find that rarely there is a Pali word that they typically translate it as emotion. The closest I can think of is the word citta. Citta. Just now I passed nearby here. There's a mall called Citta Mall. Citta Mall. So it's CITTA, not the animal cheetah. The closest that I can think of is the citta. In the Satipatthana Sutta, on the four foundation of mindfulness, one of the foundation is the mindfulness, contemplation or mindfulness of the mind. Cittanupassana. Very good. So that is the closest, but it's not exactly the same, but that is the closest. So in brief, emotion is any strong feeling. So what are the inside out one emotions? So we have disgust, fear, joy, sadness, and the last one is anger. So these are very strong emotions. So emotions are strong feeling. Inside out two. By the way, I forgot to dedicate this talk. I want to dedicate this talk to all the inside out fans. How many of you have watched Inside Out 1? You already watched Inside Out 1. Okay, you watch Inside Out 2. Okay, you watch Inside Out 3. Watching now. Yeah, this talk is dedicated to all Inside Out fans. I wish all of you safe, healthy, happy. Yeah. So those of you who watch Inside Out 2, what are the extra emotions? Boredom. Boredom has a special name, isn't it? It's pronounced as envy. The spelling is ENNUI, but the pronunciation is envy, which means boredom. Other emotions inside out too. Anxiety. In fact, anxiety is the main character, 𝐂𝐸𝐽𝐷, the main actress. Yeah. What else? Anger. No, anger is inside one. Envy. Yes, envy. So there's envy and envy. And envy is the one related to jealousy. The one related to boredom is called envy. Yeah. So those of you who are the kanchong type, worry type, the jatlat type, the die lor type, I'm sure when you watch this Inside Out 2, you can relate very well to anxiety, isn't it? Yeah. Actually, when the movie came out, I felt very stressful. Not very stressful, because all my patients, they all watched already. They come and critic, doctor, have you watched already? Watch already. I must go and watch that. By the way, most of my patients in my clinic, they are the kanchong type, the anxious type. Anxious type. So these are the extra emotions. I have some suggestions for Inside Out 3. Later I share with you. If you ever invite me to be the consultant, I will suggest a few more Buddhist related characters in Inside Out 3. That's envy. The spelling is ENNUI. Sounds like ennui. But I learned that the pronunciation is actually envy. It's a French word. Yeah, it's a very interesting emotion. It's a combination of boredom, restless, aimless, numbness, and dissatisfied. Similar to what mental state described in Buddhism, in Buddhist teaching? Yes, very good. Which one? Sloth and torpor. Yeah, that's similar to sloth and torpor. Yeah. So it's again one of the emotions. Okay, what is emotion from a biological point of view? Actually, emotion has a biological basis. So there's a part of our brain which regulates emotion. And then the name of the part of the brain is called the limbic system. Exactly where is limbic system? Well, I can't take out my brain to show you. Luckily, we have a 3D model over here. That part which is red in color, it is quite embedded deeply in the brain. So that part of the brain is called the limbic system, which is the emotional brain. And is considered an advancement in evolution. Do you think animals have emotions? Yes, but not as complex as human beings. Yeah. So having a limbic system which is more developed is considered an advancement in evolution. So that's the limbic system. Under the limbic system, there are many structures. That's why it's called a system. It's not just one structure. There are many structures. And one of the more popular structures in the limbic system is known as amygdala. How many of you have heard of this term, amygdala? I think last time previously when I gave a talk here related to stress and anxiety, I mentioned about amygdala. Amygdala is actually the anger and anxiety center. And interestingly, mindfulness training, meditation, mindfulness training has been shown to reduce amygdala activity, reduce anger, and reduce anxiety symptoms. Those of you who have not heard of this word amygdala, I have a very simple way to help you to remember this word. Because it's an anger anxiety center, you just remember Amy the Dracula. Amy the Dracula. Especially if you're a friend by the name Amy. Anyone here by the name Amy? Any Amy? Look, I'm sure in your life you have friends with the name Amy. So remember Amy the Dracula. It's very scary. So amygdala is the anxiety and anger center. So emotion is not just psychological, it has a biological basis. So it's a part of the brain, the limbic system, for example, the amygdala, which regulates our emotion. So far so good? Yes. Very good. According to research by Dr. Paul Ekman, who is an expert in emotions, there are 6 basic emotions. In what way they are basic? They have very distinct facial expression, very characteristic, distinct facial expressions. And it doesn't matter whether you're Malay or Chinese or Indian or Hokkien or Teochew, whichever part of the world you come from, this emotion, the expressions are same. Okay? And these 6 basic emotions by Dr. Paul Ekman are happiness, sadness, surprise, fear, anger, and disgust. If I didn't show you the words, do you think they can recognize a facial expression? Can? All, for all? Not all. Which one is the easiest to recognize? Happiness, sadness. Maybe because you are sad, you can recognize sadness better. So, anyway, according to Dr. Paul Ekman, they are basic because they have very characteristic features which is universal. Now test. Just now I show you the words to describe emotions. This one, the similar facial expressions, but without the words to describe the emotion. Okay. Since I said happiness is the easiest to recognize, so which one is happiness? Let's say this is A, this is B, this is C, this is D, E, and F. So which one is happy? A, B, C, D, E, happy. Okay. So which one is angry? Angry, Angry, right? Sad. This one sad. Okay. I think these three are quite easy to recognize. Angry, happy, sad. Okay, left with fear. Boy. D. Boy. Boy. Fear. This one? Disgust. Okay, disgust. And this one? Surprise. Okay. To test whether you're mindful enough or not. Which emotion is not in inside out one? Surprise, surprise is not there. Surprise. Anyway, they did further research. They actually found out that out of the 6, only 4 are really basic. So which 4 you think be really basic, even more basic? Like you cannot get it wrong one. Sure we'll get it correct. And it's yes, happy, sad, anger, fear. These are 4 most basic. In fact, disgust is a little bit of anger. Okay? Then for surprise, it's a little bit of fear. So they found later the most basic one only 4. It's also a thing called a primary emotion and secondary emotion. So emotions are very complex, you know. Sometimes we think we're angry, actually we are sad. Or the sad person can be an angry person. Emotion can be complex. Okay? Like in my clinic, often I see clients, women who are depressed. They come to me, the presentation is depression, crying. But you talk to them more, you may discover the primary emotion is anger. So instead of sadness, it could be anger. So anger is the primary emotion. Sadness is the secondary emotion. Okay. On the other hand, you may see men who come to the clinic or present with anxiety. Present with anger. Very irritable, result with anger, but the actual emotion is fear. Fear. This is what I mean by the primary and secondary emotion. So emotions can be quite complex, although it's an advancement in evolution, but it comes with certain challenges as well. Emotion can be very complex. So there's a thing called the positive and negative emotion. I think as a Buddhist, we are quite familiar with this. Okay? Example of positive emotions are emotions that arise from wholesome mental states. Okay? Examples are loving kindness, metta, is a positive emotion. Karuna, compassion, is a positive emotion. Mudita, sympathetic joy, is a positive emotion. Upekkha is also a positive emotion. So these are all the positive emotions. All the negative emotions, a typical one is like anger. Some time ago, I created a new word. Called EMPAJOY. 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 To represent mudita. Interestingly, in English, there isn't a single word to represent the concept of mudita. Is there one word in English which means you happy, I happy? Le hua hi, I hua hi. Rejoice, a bit general. A bit general. To rejoice on, a bit general. Yes, closest is rejoice. Rejoice, you have to use a whole sentence. I rejoice on your happiness. I rejoice on the success of the activity. So I came up with the words called EMPAJOY. I believe if there is a word to relate to this positive emotion, then we can cultivate the emotion more. Interestingly, in German, any Germans here? In German, there's a word called Schadenfreude. Schadenfreude. Basically, I'm happy when you are sad. When you suffer, I'm happy. Got such a word, Schadenfreude. You suffer, I'm happy because you suffer. So it's a bit the other way around, the ballet of mudita. So the EMPAJOY. So I introduce you EMPAJOY, EMPAJOY. I feel joyful when you're happy. You hwahi, I hwahi. So positive emotions, the root is wisdom. Okay, it gives rise to pleasant feeling of the mind, pleasant feeling of the body, and the effect is positive in terms of relationship, in terms of behavior, in terms of mental health. Positive emotions have positive effect. Of course, for negative emotion is the other way around. So as a psychiatrist, I want to emphasize that negative emotion is one of the causes and conditions, one of the factors that can lead to mental illness, like mood disorder, like depression, like bipolar disorder. So negative emotion is one of the factors that can lead to a mood disorder. By the way, earlier there was a slide. Remember one of the earlier slides, I talked about the basic definitions of emotion. I mentioned that emotion is strong feeling. There's actually another word in the slide that I forgot to emphasize. There's another word called mood. Mood. So what's the difference between emotion, feeling, and mood? Emotion is any strong feeling. A mood is a sustained emotion. So if you have certain emotion, like example, sadness. If only Monday is sad, Monday is coming tomorrow. It's only Monday is not called clinical depression. That is called Monday morning blues. Well, it's still a sad emotion, but it's just emotion because it's short-lived. If it happens for a long time, that is called a mood. So fast, okay? A sustained emotion is called mood. If that sustained emotion is a problematic, it disrupts our life, that is called a mood disorder. Can follow so far? Emotion is strong feeling. Mood is sustained emotion. If the mood is problematic, it affects our life negatively, it becomes a mood disorder like depression or bipolar disorder. I also would like to highlight, especially in the third part of this talk, I'm going to recommend various approaches to manage our emotion. It's important to mention that if you're on treatment for any mental health conditions, please do not use whatever you listen to it to replace your professional treatment. Please continue with your professional treatment, especially if I'm your doctor. So emotion got positive, got negative. Maybe one last point to highlight. Positive emotion can support spiritual progress as well. So the 4 Brahma Viharas, loving kindness, compassion, they can support spiritual progress. This is one of the previous talks I've given. So one of the negative emotion, which is highlighted a lot in Buddhism, is anger. I've given a whole talk on anger management. So if you are interested, you can go to our YouTube channel. There's a whole talk on anger management. That's the QR code. Let's explore a little bit of fear. I was talking about emotion can be positive or negative, or maybe the Buddhist term is wholesome, unwholesome. How about fear? Anger most of the time, I would say 99% of the time, anger is negative. Anger is unwholesome. Anger is destructive most of the time, 99.999%. How about fear? From Buddhist perspective, is fear wholesome or unwholesome? Is fear positive or negative? What do you think? It depends. You have joined my mindful gym program before, is it? Program that I teach, I encourage the participants to have an open mind. So I always encourage them to think along the lines of it depends. So you're not joined before. Then no need to join already because you got it already. Depends, very good. Depends on what? You got it.
Because from my understanding, there's
very good.
So it's like good health.
Very good. Sec for you. Very good, very good. Yeah. Of course, the fear in the form of panic attack, fear in the form of anxiety, that one is most of the time is not helpful. But it's 𝐓𝐫𝐸𝐴𝐴𝐷𝐸. It's fear of breaking the precept. It's good, right? Fear of doing bad things. That is useful, that is good. So it's true. That's why I used to think, how come when the Buddha talk about the three evil roots, he always talk about greed, hatred, delusion, correct? Like greed, hatred, delusion, right? 贪嗔痴, right? Why he never mention fear? I got the answer already. Because fear can be wholesome, can be unwholesome. It can be a positive emotion, it can be also a negative emotion. Okay, basic function of emotion. Okay. So sometimes we talk of emotions, we think of anger, we think of fear. Sometimes we forget that actually emotion can be useful, emotion can be wholesome. There are reasons why we evolve emotions. Remember just now I said emotion is an advancement in evolution. So it has a lot of basic function. So you should learn to be grateful to our emotion. One function is survival function. Okay, we need fear can be useful. Okay, for example, there's a fire now. You think we should just all sit here, chant Namo Tassa and meditate? We need a fear response to run. So emotion is important for basic survival. Emotion is also important for communication, connection. Isn't it? Yeah. If there is no empathy, it's very difficult to build relationship. If I do not know that you don't like me, susah lah. I don't know how to adjust what to say, what not to say. So emotion is important for social function. Okay, motivation. Yeah. So you need to have good mood to motivate us to do things. Make sense? Emotion, positive, good mood to motivate to do things. For learning as well. Okay, learning, sometimes frustration can feel negative, but sometimes frustrations help us to determine our needs. Why am I frustrated? Maybe there's some unmet needs. So emotion can help with education. Of course, emotion can support spiritual progress as well. Remember, especially the 4 Brahma Viharas, these are the positive emotion. It can support us in cultivation of wisdom. So my take-home message is, emotion is important. Even though there are negative emotions which are destructive, but emotion has its function. So far, good? Okay, so let's recap some of the things we learned. I started off by giving you a definition of emotion. So I said emotion, any strong feeling. Okay, emotion lasts for a very long time, become mood. If it's problematic, it become mood disorder. I talk about basic emotions, which are the six types of basic emotion. So the 6th one. Also mentioned about the function, and the function can be wholesome, can be unwholesome, can be positive, can be negative. Interestingly, in traditional Chinese medicine, anyone of you here who are TCM practitioner? Interestingly, in TCM, every organ in our body is associated with a certain emotion. Okay? For example, it is in TCM, traditional Chinese medicine, the heart, physical heart, is associated with joy. The spleen is associated with worry. Lung is associated with grief or depression. Liver is associated with anger. And kidney is associated with fear. Right? Does it mean that if you worry a lot, definitely it's spleen problem? No, that's not what I mean. But I'm impressed by this concept that physical health and mental health are interconnected.
No scientific. No scientific proof.
Not that I know of, not specifically, but the concept that our physical health and emotional are strongly related, that one I'm very, 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 very sure. Because a lot of my patients in my clinic with a lot of what I call it, the 𝐂𝐭𝐲𝐸𝐷 syndrome. So a lot of physical pain, here pain, there pain, sakit. They were all referred by my fellow colleagues, physicians. So they have seen the cardiologist, they have seen the gynecologist, they have seen the gastro specialist. All the doctors say there's nothing wrong. They will say either there's nothing wrong with you, or it's just a small matter, maybe a bit of gastritis. But it's still a lot of pain, and very often it's emotion, especially anxiety. So function or emotion also for maintenance of physical health. So another of my online talk, I also given a talk on the title is, though my body is sick, my mind shall be healthy. It's related to the earlier point. To take good care of emotion. When we take good care of emotion, we also take good care of our physical health. I think this will be one of the last slides under the part 1. Part 1 is all about emotions. Yeah. So in this particular slide, I want to highlight that when an emotion which is usually labeled as negative, it can be helpful as well. For example, sadness, is it good or bad? Is it positive or negative? If you're having, it depends. Depends good, yes. Of course, clinical depression is not helpful. But sadness can help us to be more reflective. Okay, can help us to introspect, to be more reflective, to slow down and reflect on life. Okay, choose another one. Of course, fear, just how you mentioned, fear can have a survival purpose. Okay, and choose another one. Embarrassment. Is it useful or not useful? Embarrassing is useful. You need to know what is embarrassing and know what is not embarrassing, isn't it? And so on. Basically, my point is an emotion which is seen as negative sometimes can have a function. Even in anger, I mentioned anger most of the time, 99% of the time is unwholesome, is negative, is destructive. But sometimes anger can help us to know our unmet needs.
So I heard from my friend, I'm not sure if this is correct or not, that's why I want to ask you. I heard that anxiety and joy is the same feeling. It's just the way the mind interprets it. Is it true?
Anxiety and joy, whether they're the same feeling? No, don't agree.
It's not the same thing.
It's not the same thing. It's not the same thing. But I know what your friend probably means. Anxiety and joy share certain physical changes. Anxiety and joy share certain physical changes. For example, in both conditions, you can have increased heart rate. So we're happy or very happy, very excited, you can have increased heart rate. Anxiety, worry, kanchiong, you can also have increased heart rate as well. Agree? So usually it's not a problem. But in one particular situation, it can be problematic. In people with panic attacks. Right? So in panic attack, usually the first time you're having a panic attack is usually something stressful. Okay? But after some time, when you have it many times already, the brain cannot differentiate. So that when you go and watch Inside Out 1 or 2, or you spend time with your kids, you're having a happy time, then you have increased heart rate, but the brain got confused. I get it? So it's happy, but nothing stressful, right? The first time maybe you had a panic attack, maybe you had a stressful time. But after that, it's no longer stressful. Things got better already. You're doing something happy, something joyful. When you're happy, joyful, the heart rate also increased, but the brain got confused. The brain will misinterpret it as anxiety. So very likely your friend mentioned that in the context of panic attack. So I use this explanation as well. And it's very important because people with panic attack, they're very worried. Now I'm happy. Happy also got increased heart rate. Happy also got increased heart rate. That must be really something wrong.
Following question, right? Then what is the difference between anxiety and panic attack? It seems like the same thing.
Very good. In fact, do you realize in Inside Out 1, anxiety wasn't there? Fear was there. In Inside Out 2, we have anxiety. Maybe Inside Out 3, they should have panic attack. Okay, good question. I'll try to answer. Okay. Fear is usually present moment related, and it's very specific. Okay. For example, I like to ask, how many of you who are afraid of public speaking? Are you afraid of public speaking? Okay. If you are afraid of public speaking, if I were to ask you to come forward and share with us, how did you get to know about this place, why did you come for this place, typically it will generate a lot of fear. So it's very specific. So if I ask you to come out, you develop the fear. It's very specific for public speaking. So you can have fear of public speaking, fear of driving, fear of flying. Whereas anxiety is very future oriented. What if this happens? What if that happens? What if this doesn't happen? What if that doesn't happen? It's very future oriented and it's not specific. It can be anything. It can be almost everything. That's anxiety.
So, sorry, the fear you mentioned is basically the panic attack, is it?
No, I'm not finished the third part. Not yet. Fear is very specific. Like fear of public speaking. Anxiety is very future, is almost everything. Solution is worse. Of course, anxiety is worse. You compare inside out 1, 2, the fear, anxiety. Anxiety is panic attack. Panic attack, it is very intense. It's very intense. Okay, it comes with a lot of physical symptoms like heart palpitation, shortness of breath, hands tremor. You feel giddy. You feel like you want to faint. You're scared you will die. You think you have a stroke. You think you have a heart attack. And it's very intense. So intense to the point that you may want to go to the emergency department straight away. That's panic attack. They're all brothers, sisters, like abang adik lah.
Hi, Dr. Bang. I was quite interested in your slide regarding the TCM one.
Yes.
And I understand, I've been reading and I see that gut health or the gut microbiome can somehow affect that mental health.
Yes, correct.
What are your views on this? So,
yes, I believe. Definitely. I have very sensitive stomach. My mom also has very sensitive stomach. If you heard of IBS, you know what is IBS? Irritable bowel syndrome. My mom has very severe IBS. I have a little bit, not that bad. And she's on probiotic. Not that I want to promote probiotic, but what I will highlight is the mind and body is connected, and the stomach discomfort, the GI symptoms is very often related to emotional state. So I strongly believe in that. And the part which I'm not sure is because it seems to say that a specific emotion will affect specific organ. That one I'm a bit doubtful. So I strongly believe emotional state affect the tummy, and the tummy will affect the emotional state. That one I'm 100% convinced. Your question is whether panic attack is the same as anxiety attack. Yes and no. It depends. That is my favorite phrase. It depends. The official term, the technical term in psychology and psychiatry is called panic attack. The official term is called panic attack. Whereas anxiety attack is not a technical term. It's more on general term. So some people, when they use the word anxiety attack, they are referring to panic attack. What is an actual panic attack would be just what I mentioned just now. It's very, very sudden, intense. What is fear? Sudden, intense fear with a lot of physical symptoms. It doesn't last very long. Then you get very confused, get very scared. You go and see a lot of doctors. They say nothing wrong with you, and you get more confused and more worried. That is the actual description, and the actual term is called panic attack. Whereas anxiety attack is more a layman term. Sometimes they refer to panic attack. Sometimes they refer to something else. Okay. So some people may confuse. They use anxiety attack. They may refer to panic attack, or they just use anxiety to refer anxiety attack as just anxiety, the free floating what if. So I'll suggest use more accurate terms. If you mean the very sudden intent, you call it panic attack. If you mean the free floating one, what if did happen, what if did happen, what if don't happen, that one is more of anxiety.